Hi friends, I'm Dr. Adarsh Anapredi. I'm an orthopedic surgeon and a joint replacement surgeon at Sunshine Hospitals. And in this video, I'll be speaking about office-related musculoskeletal disorders and ergonomics, which is a word which has been increasingly used in the recent times, especially in the times of work from home. So the first thing we want to know is, what is the definition? What are MSDs? Okay. And I'm not talking about this MSD, who is a legend in cricket. I'm not talking about Mahendra Singh Dhoni. I'm talking about musculoskeletal disorders. That's what MSD stands for. Now, of course, MSD himself, Dhoni himself is not exempt from MSDs. He can also get musculoskeletal disorders sometimes, okay, though it's very rare. We have hardly seen him suffer from this. But what does this mean? Musculoskeletal. Musculo means muscles, and skeletal means the skeletal system, including the bones and the joints. And a disorder obviously is any abnormality in this particular system. Other names for this are RMI or repetitive motion injuries, RSI, repetitive strain injuries, cumulative trauma disorders, ergonomic disorders, or work-related musculoskeletal injuries or musculoskeletal disorders. So these are all different names for the same thing, and we can use a panacea term that is MSD or musculoskeletal disorders. So what are the different risk factors for MSDs? Awkward sitting positions is definitely one of the most important risk factors. Second are sustained postures, repetitive motions, poor lighting and temperature extremes, insufficient breaks, and heavy lifting can all lead to MSDs at the workplace. Any work which is performed mechanically or electronically for more than 4 hours at a time will invariably lead to some form or some degree of MSD. First thing is the bad posture. If you are familiar with this kind of posture when you go to sleep or when you're working, completely odd posture, that is the most severe and most common risk factor for this problem. Next is repetitive action. So if you're typing throughout the day and you're going to keep on performing the same action over and over again, there's a definitely higher risk of getting an MSD in that particular joint. The next, so if you want to summarize, the risk factors of MSDs can be classified as ergonomic risk factors and individual risk factors. Ergonomic means work-related, like force, repetition, and posture. Individual risk factors are as per that person, like poor work practices, poor fitness, and poor health habits. And all these together can combine together to form musculoskeletal disorders. So what is the most common work-related MSDs in the office? So MSDs, as I mentioned earlier, can affect the joints, the ligaments, the muscles, the tendons, and the nerves. Okay, and it can affect any part of the body: shoulder, elbow, the wrist, the hips, the knees, and the ankles as well. So you have different types of MSDs like neck pain or tension neck syndrome, shoulder pain, epicondylitis or elbow pain, which can either be tennis elbow or golfer's elbow, and bursitis, carpal tunnel syndrome, that is at the wrist, decurvane tenosynovitis, again at the wrist, trigger finger, okay, lower back pain, and knee pain as well. These are just a few of the different MSDs that we can see. What are the symptoms of MSDs? The first thing is you can have tingling or numbness in the hands and the fingers. This is all depending on which part of the body is getting affected. Then you can have joint swelling, stiffness, or inflammation, most commonly in the knee joints. You can have muscle weakness, tightness, spasms, cramping, or pain. So different types of manifestations of muscle abnormalities. Then you may have shoulder, neck, or back pain or discomfort. You may have a range of motion or grip strength loss. So you may have a restricted range of motion of the shoulder or of the elbow joint, and you may have a little bit of a strength loss in the grip. You may also have shooting or stabbing pains through the arms or the legs. So that brings us to a term which is very, very important nowadays, and this is known as ergonomics. Ergonomics is defined as the process of changing the work environment to fit the physical requirements and limitations of employees rather than the other way around. So that means you try to change your work environment according to that particular that person's different problems. So, for example, computers and related products such as computer desks and chairs are frequently the focus of ergonomic design. So nowadays they're making very good ergonomic tables and ergonomic chairs. These products are used for extended periods of time in a typical workday. That's why they are the ones which are usually focused upon in terms of ergonomics. If they're poorly designed or improperly adjusted for human use, the person using them may suffer unnecessary fatigue, stress, and even injury. Okay, so just a brief glimpse of what is a good posture, good ergonomics, or good work-related habits. So if you see the guy on the top, he's doing everything wrong. The guy in the middle is doing everything right. And the guy, and the third guy is preventing any MSDs happening in the future. So first thing, when you're picking up anything, try not to bend at the back. You're going to really hurt your lower back. And see how he's sitting on the chair. He's sitting with a curved back. He's not resting it on the chair, and his buttocks are too far forwards. The angle is almost an obtuse angle. His knees are also not in a very good angle, and his screen is at a completely different level as well. Okay. Now, if you compare with this guy in the middle, he is bending down at the knees and lifting up his objects. And this chap is sitting with a nice backrest, with a good arm rest as well. And the buttocks are nicely planted in the back of the chair. The hip joint is 90 degrees and the knee joint is 90 degrees. The foot on the ankle joint is again at 90 degrees, and the screen is at eye level. And the third thing is about the phones. This is the most important and most common cause of neck pains and headache. If you are going to slouch and try to reach down to your phone, which is around this level, it's going to definitely cause issues. If you can bring the phone up to your level and with a straight back, that's definitely going to help you. And again, the fourth one, if you use a laptop, literally like a laptop on your lap, it's going to definitely give you a bad posture. It's always better to use a small table or a desk and prop your laptop on top of it. So again, this is a small pictorial description of everything that you can do wrong. Bad backrest, curved back, his head is way far forward, his elbows are too acute angle, and there's not enough space below the desk for his knees. So all these things were going to lead to some kind of MSDs. Okay, so the wrong sitting position, as I mentioned earlier, is something where your back is totally curved forwards, your head is too far forward ahead of your shoulders, and your backrest is not being used. You have an obtuse angle at the hip joint and a not 90 degrees at the knee joint. These are all bad. Correct sitting posture, back is rested nicely with a nice anterior curve like this, forward curve, ears above shoulders and shoulders above the hips. This is most important. Your whole ears and shoulders and hips should be in line with each other. The screen should be at eye level. Okay, you should have a nice arm rest with your elbow and your wrist and your keypad in the same level. Okay, your knees should be preferably at 90 degrees, and you should have a nice footrest. Nowadays, people are adopting correct standing desks or standing office, where they just stand at the desk and they don't have, and their posture is automatically corrected. So this is a workstation observation checklist. It's used very increasingly nowadays in the Western countries. They have a checklist for all offices to make sure that they are ergonomically suitable for the employees. So first thing they look at is the monitor. The monitor should be at arm's length away from the user. The top of the monitor should be at the eye level or just slightly below. The center of the monitor should be placed directly in line with the middle of the body. The glare should be minimized and the head should be in a neutral position without straining forwards or backwards. The keyboard should be at the right height, that is at elbow height, not above or not below, and should be positioned in front of the user, not to the sides. At the elbows at the side and the angle about 90 to 110 degrees. So the elbow should be at the side of the body and your 90 degrees angle should be there. Okay, the forearms should be parallel to the floor. I will show all these in a diagram as well. The wrist should be straight, not bending inwards or outwards. The upper hands and the elbows should be close to the body when the hands are on the keyboard, and the shoulders should be relaxed when the hands are on the keyboard. The mouse should be placed close to the keyboard, and the wrist should be in a straight or a neutral position. Chairs is the most important thing, and the most easily adjustable thing is the chair. There should be adequate back support. It's the most important thing. Back posture should be 90 to 110 degrees. The feet should be supported by the floor or a footrest. If you're very short and you're not able to reach the floor, you should use a footrest. The thigh should be parallel to the floor. The upper body should be straight, as I mentioned, ears above shoulders and shoulders above the hips. Okay, the knees should be around the same height as the hip joint with the feet slightly forwards. Should allow special clearance to move the knee under the desk, and you should make sure there's not too much of cramping under the desk. And of course, that brings us to the desk itself. There should be enough room for the legs to comfortably fit, and the items which are used most often should be within arm's length of reach. Okay, so this is the workstation checklist. Now, as I said, this is just a cute cartoon I found to define ergonomics. You are adjusting your office surroundings to that particular employee. That is, if you have a long neck, you go to prop up your monitor so that you're reaching your eye level rather than straining your neck down and reaching to the level of the monitor. Okay, so good office ergonomics, just again to summarize, this is a wonderful diagram here. and I'll mention the points on the side. First, look at the chair. There should be a good back support supporting the spinal curves. So the lower back should always be curved forward like this. Okay. Next, adjust the height of the chair so that the feet rest flat on the floor or a footrest. So she has a footrest because she's a bit short, but the feet should be lying nicely at an angle of 90 degrees. And the thighs should be parallel to the floor. This is very important. The thighs should be parallel to the floor. If the chair is too high, the thighs will be in this angle. If the chair is too low, the thighs will be in this angle. So you should make sure the thighs are at 90 degrees. And they're parallel to the floor. Adjust the armrest so that the arms gently rest on them with shoulders relaxed. So this particular diagram doesn't have an armrest, but it's always good to have an armrest at the level of the elbows and the wrist to rest your forearms. So the key objects like the phone, stapler, and all should be close to the body to minimize reaching. Okay, next to talk about the keyboard and the mouse. The most commonly used thing should be within easy reach and on the same surface. Okay, so keyboard and mouse on the same surface. While typing or using the mouse, keep the wrist straight and the upper arms close to the body. So you see here, the wrists are straight. They're not bent up or down. The upper arms should be close to the body and the hands should be at the level of the elbows. Okay, so the hands are in line with the elbows. The desk, under the desk, you should make sure there's enough clearance for the knees and the thighs, as well as the feet. So there should be enough clearance and enough space down here. Use a footrest to support your feet as needed. And the monitor, most important thing, should be directly in front of you, okay? Or maybe slightly below the eye level is allowed, but not too far down over here. And should be an arm's length away is the appropriate length from the person. The top of the screen should be at or slightly below the eye level, as I mentioned, and should be directly behind the keyboard. So now let's talk about ergonomics at home. So a lot of people are nowadays working from home because of the pandemic. And things are even worse now. Msds are much more common. You may think that you're much more comfortable in your home turf, but actually this leads to more Msds because of wrong postures, not having good ergonomics and good workstation at home, right? So I think some people probably end up working like this when you're at home. You get too comfortable, and this leads to a lot of issues in the body. So again, even at home, you should try to maintain all the important things that I mentioned earlier. I'm going to run through them again. The distance between the eyes and the screen should be around 65 to 75 centimeters. The shoulders should be relaxed. The back support should not be too flexible and it should be nice and firm, but it should give a forward curve to the back. Angle of the elbow should be around 90 degrees at the same level as the wrist. Angle of the hip should be 90 degrees. Angle of the knee should be 90 degrees. Should have a nice footrest over here. Height of the chair should be adjusted to the person's height. The wrist should be free and straight and in line with the forearm. Keyboard tray should be lower than the table, but not touching the knees. And the upper frame of the screen should be the same height as the eyes. Okay, so again, try to recreate this same workstation at home. That's very, very important. Get a small corner of your house and make that your workstation. And make it a strict rule that if you're working, if you're doing work, office work from home, you're going to go sit in your small workstation at home and do it there, not on your bed, not on the sofa. So occasionally responding to emails at the kitchen table or quickly checking from things from your couch is okay. But when you're working for 8 hours at a stretch, home ergonomics are very, very important. You should create a more permanent workspace at home, comfortable chair and a desk large enough to house your computer or laptop and supplies. Getting the best out of furniture that isn't adjustable is very important. So not everyone has good adjustable chairs or desks at home. It's not always practical, but you try to create a good workspace with whatever you have. For example, if you're sitting on a sofa which is very low and it's not able to reach the height of the table, prop yourself up with a couple of pillows. And if your desk which you're using is too low down and your laptop screen is too low down, put a couple of books underneath and raise the level of the laptop up. So you can do some kind of, you can use the word jugaad to create a nice workstation at home to make sure that you're doing things in an ergonomically correct fashion. Take a couch, cushion, or a pillow or a small laptop desk to raise it to nearly eye level, as I just mentioned. Okay, now let's move on to when you actually get MSDs. Now, whatever I mentioned till now are ergonomics which are trying to avoid musculoskeletal disorders, but it's not always practical or possible to completely avoid. You may end up actually causing some injury or having some kind of strain on the different joints of the body. So I'm going to mention each different part, most common MSDs, and how we have to go about treating them. So let's start with neck pain. If you're going to end up like Meryl Streep in this movie with your neck completely twisted and having a lot of pain, I'm going to tell you what's to be done for that. Okay. So the first, let's talk about the causes due to a bad postures. This is most common posture that people end up in when they're working. The head is far in front of the shoulders. It's very, very wrong. should bring the screen to you, not the other way around. You don't bring yourself to the screen, bring the screen to you. And my favorite funda, I tell everyone, make it a small post-it and stick it on your laptop or your computer. Ears above shoulders and shoulders above the hips. Ears should be above shoulders and shoulders should be above the hips, and you should maintain that posture throughout your working period. Another way to make sure that you can avoid neck pain is to get a nice backrest chair. Lower back ke liye, you can use this small lower back pillow, and upper back you should use a nice pillow to maintain the forward curve. Remember one thing, the neck and the lower back should always have a forward curve like this. Okay, so it should be curved forwards, both the neck and the lower back. So anything which helps to maintain the forward curve is going to be helping. So like this small cervical pillow and a small lumbar pillow will help to maintain the curve and reduce the strain on the neck and the lower back, as opposed to this where you have your curves which are reversed. If you have a concave curve instead, that means you're going to get more pressure on the neck and the lower back. Okay, I'm just going to play this video. Neck exercises. 1 second. Yeah. So if you learn these neck exercises and do these regularly, it will definitely help to prevent neck pain from happening in the future. Hi, I'm Dr. Adarsh, an orthopedic surgeon at Sunshine Hospitals. Today I'll just be mentioning a few simple exercises for the neck which can prevent neck pain, especially when you're staying at home and working at home at the desk for the whole day. You can get a lot of neck pain. So you have to strengthen the muscles around the neck. To do that, all you have to do is see there are muscles all around the neck, 360 degrees. So you have to exert pressure against some force. So for example, if you want to strengthen these muscles, put your hand on the cheek and push against the hand, and so that these become taut. Hold for a few seconds and then leave it. Then they do the same thing for the opposite side. For the back muscles, you can put your hands over your forehead and push forwards. And the same thing for the front muscles, put your hands in the back and push backwards. These are all different exercises to strengthen the muscles around the neck, and which will in turn reduce the neck pain. Okay, so now let's move on to the next joint. Most common joint is the shoulder pain. You can have something known as rotator cuff tendinitis. Okay, so what are the symptoms? You have pain while moving the shoulder. Okay, any movement on the shoulder will cause pain. Restricted range of motion, that is, you're not able to probably lift above your head or take it behind your back. Okay, this is, and next, again, how you're going to avoid this is maintain the same posture, ears above shoulders and shoulders above the hips. That's very, very important. These are some good shoulder exercises that you can practice. They're very simple. You can run through these. There are around 6 exercises you can do. You have to be very regular and increase the number of repetitions every day. And you can slowly strengthen the muscles around the shoulder and reduce this kind of shoulder pain. Next, let's talk about something known as tennis elbow. Tennis elbow doesn't mean you're going to get a tennis racket like this. Okay. But it doesn't only happen to tennis players. Okay. It just means that you're straining on the tendons which are coming from the elbow. So again, the wrong posture and wrong elbow position are going to cause this. Typical desktop typing posture that increases muscle fatigue and injury risk is when the elbow is in an acute angle like this. That means your desk is not at the right height and your chair is not at the right height. If you have a nice armrest and your elbow is at 90 degrees at level of the keyboard, you can avoid any of these elbow problems. So you have 2 main problems of the elbow. One is golfer's elbow and one is tennis elbow. So golfer's elbow is when you have pain on the inner side of the elbow joint, and tennis elbow is when you have pain on the outer side of the elbow joint. But both of them, the treatment is kind of similar. Okay, so how do you treat these elbow pains? First, as I said, a proper support for the elbows is very, very important. You can use these kind of elbow supports, and proper position is very important. Again, the elbow should be at the level of your mouse and keyboard. Rest is important. Once the pain does start, you have to give it rest. You should try to make sure that you're avoiding driving or anything which requires a lot of movement of the elbow. Medication to reduce the inflammation. Ice application on the elbow joint will definitely reduce the pain and swelling. And a tennis elbow splint or a brace is just a small band which is put on just in front of the elbow on the forearm, and this will help to reduce the strain on the tendons and in turn the elbow pain. Now let's move to something known as the carpal tunnel syndrome, which is basically pain at the wrist joint, leading to numbness and pain in the palm as well as the fingers. This is called as carpal tunnel syndrome. Okay. So this can happen if you're having a wrong position of using a keyboard. Instead of having it straight, you're angulating it outwards, and also you're not having the keyboard at the right height, and then you're having to bend more at the elbow and the wrist joint. This will cause a lot of strain on the wrist joint. So what are the symptoms? You may have pain at the wrist joint itself, and you'll have tingling and numbness in the fingers. Why this happens is there's a nerve called the median nerve which crosses through the wrist and reaches the hand, the palm. And sometimes this transverse carpal ligament, because of the strain, can start pressing on the nerve and cause pain and tingling and numbness. So what is the treatment? Medication again to reduce the pain for the time being. Rest is very important for the wrist once you start getting pain. Support, you have some nice keyboards like this with good wrist support. And in severe cases, a minor surgery may be required where they release that transverse ligament to free up the nerve. Now let's move on to the next thing, which is the lower back pain. This is again a very, very common thing that we see in our OP. Okay. So again, how do you treat it? A lower back support with the forward curve being maintained is very, very important. You don't need to have something like this. You can even use a small lumbar pillow is also enough. Exercises for the lower back is extremely important to strengthen the muscles and to prevent this from recurring. You can use a lumbar belt, but that should be only a temporary thing. If you use it for too long, your muscles may get used to it and become weaker. So only in the acute phase should you use that. If the pain radiates to the legs, if your pain is not only restricted to the back, but also radiating to the buttocks and the legs, an MRI may have to be done to rule out a disc protrusion. So these are some good lower back exercises. You can have a look at these and try to do them regularly. This will help to strengthen the muscles in the lower back and to prevent the strain on the back. Now, finally, the knee pain. This is something that's close to my heart because I am mostly a knee surgeon, and I wish just kissing the knee joint like this can solve all the issues. But if that were the case, I would be out of a job. But this is also a very common problem, and it happens if you're not sitting in the right posture and if you're sitting for too long at the desk without getting up. So the treatment can be proper position of sitting, as I mentioned, 90 degrees angle at the knee joint. Every 40 minutes to 1 hour, put an alarm on your phone, walk around for 2 minutes and sit again. That will help to reduce the strain on the joint and help to keep the joint very free. The next thing is knee exercise is the most important thing. It helps to strengthen the quadriceps muscle above the knee joint, and that in turn reduces the load on the joint. And of course, medication in severe cases. I'm going to show you another video about knee exercises, and you can learn these. And if you do these regularly, you should be able to get rid of your knee pain.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. First, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Up. 1, 2, 3, 4, 5. Relax. Again up. 3, 4, 5, 6, 7, 8, 9, 10. Relax. Up. Good. Keep it straight. Keep it straight. 2, 3, towards you. Hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax.
Okay. Strengthening up. Okay, so these are very important exercises. They have to be done regularly, not just once in a while. Then only you'll get the best benefit out of these. Thank you. So this is about the topic. It concludes the topic on ergonomics and work-related disorders. So this is the website. You can check out my website, my Instagram page, or my YouTube, and you can take appointments in case you have any queries on the same. Thank you.